Well, a warm welcome to this talk. And I've had numerous requests to talk about the Nipah virus, which is currently spreading person to person in parts of Asia. The World Health Organization, for example, has said it's got epidemic potential. So is this a real risk? Should we be worried about it? Is it coming to Western countries? And the answer to this question is yes, it is a risk, and no, I don't think it is much of a risk at the moment, actually. The reason I'm saying yes, it is a potential risk is it could be weaponised. It could be messed around with in laboratories. Gain-of-function research could be carried out on it. It would leak, and then, of course, it would be a significant risk. And also, there is a small risk that the virus would mutate in nature and cause a greater risk, although that risk is relatively small. Although with more encroachment into natural habitats, that risk increases. So do I think we're going to see cases of Nipah virus spreading person to person in the United States, Canada, Australia, United Kingdom? No, I don't, given the information we have at the moment. So that is what this video is about. If you're worried about Nipah virus spreading in the West, I would stop worrying, at least for the time being, until new information comes to light. If you want more information and the rationale and the references for that, do stick around because it really is quite interesting. Now, this is the natural host here, this good-looking chap, the fruit bat, or sometimes called the flying fox, for fairly obvious reasons. This is the natural zoonotic reservoir of this virus in nature. For some reason, bats hang around upside down, never quite worked that one out. And while I'm showing you some pictures, I will show you the current areas where outbreaks have been recorded. So we have some here in Kerala, in southern India. Bangladesh and East Bengal are well-known outbreak areas. In fact, there's cases in Bengal and Bangladesh pretty well every year, I think. Parts of Malaysia and part there of the Philippines. So apart from that, cases have not been reported so far. So Canada, UK, United States, Australia, no cases yet reported at all in the country, at least not confirmed. So that's good news. Now, the bad news is that it is a serious infectious disease, periodically causes outbreaks in Asia, but the case fatality is high. Now, this source here, I think this is from the CDC, it says 40 to 75%. During outbreaks, 10 to 92%, according to Boston University research. And person-to-person transmission is possible. There's been person-to-person transmission in close care home and hospital environments where someone's been sick in the home. It's been transmitted from person to person. Overcrowded and poorly ventilated environments, as many of our UK hospitals sadly are, since they've been revamped, since we got rid of the old Nightingale-style hospitals where you could open big windows and let in lots of fresh air. Now you can't. So they're now poorly ventilated environments. Progress. Care home or... Sorry about that. I need to stop being sarcastic. Of course it's not progress. They do say it's progress though, but it isn't. Close care home hospital environments. Transmission via droplet is suspected. Now, it looks like this isn't rapidly transmitted. It's not airborne in the way that influenza or SARS coronavirus 2 was. But the possibility of close-up droplet transmission is there if someone has a respiratory manifestation of the disease. So it is there, but it's not going to be a rapid mode of transmission like it was with SARS coronavirus 2, for example. So nothing I'm too worried about there, really, unless you're in close contact. But the World Health Organization has listed Nipah virus as an epidemic threat, which... I suppose they are right, but there again, they want to attract interest, I suppose, requiring urgent research and development action, including vaccine development. Well, of course, more research is always good. In fact, when I was marking students' essays, I had to introduce a law that they couldn't say in the last paragraph, but more research is needed, because that's an axiom. It's always true. Anyway, a bit more detail. Potential risks, as we've said, environmental encroachment, as the environment of these rather magnificent creatures, it has to be said, can be encroached upon, making them change their lifestyle. Not the bat's fault, but environmental change can be problematic, as of course we all know. Viral mutation, a possibility. Gain of function research. Is someone jiggery pokering around with this in a lab? I do hope not, but it's a real risk. If this virus, and remember what's it got, let's say the average is about 57% case fatality rate. So if you get this infection, you're 57% chance you're going to die, even if you're young and fit. And if people are messing around with this in the laboratory to increase its transmissibility, then it's got massive pandemic potential. We have no specific drug treatment. We have no specific vaccine. If this leaked from a lab where they had increased its gain of function so it could transmit person to person, you don't need me to tell you the consequences of half the world's population dying. So let's hope that is not happening. No evidence that it is. Let's hope that it's not. Because we don't want weaponisation of viruses, absolutely not. Risk of transmission during flights is there, of course. If someone had especially a respiratory form and you've got a 10-hour flight from India or something, then that is a risk of transmission. So that risk of transmission is there, although it's small. And as we've said so far, no reported cases in Western countries, which of course is reassuring. Now, these are the references I'm using in this paper. UK government blog from the UK Health Security Agency. WHO official communication is there. Reference from the Indian government is there. Official US CDC site is there. Australian CDC site is there. And Boston University research office is there. So they're the references I'm using in this paper. And of course, I'll put those there so you can check it out for your own perusal and make sure I'm not making anything up, which of course would be bad. I'm not. This is my accurate summary of what's in these fairly definitive sources. Well, that's why we're analysing it, to see if they are definitive. but basically they are fairly good. Virus cases have never been found in the UK, US or Australia or North America, so that's good. A Nipah virus is a zoonotic virus. It can be spread from animals to humans. It can be transmitted through contaminated food or directly human to human. So if the bat or an infected animal has had a nibble of some fruit and then left the rest of it, it wouldn't be good if we ate the rest because they give infection from the saliva. So contaminated fruit is one way, because these are, of course, fruit bats. They are, as far as I know, people that study zoology can let me know, but as far as I know, they are vegetarians. First identified in 1988 or 1998 or 1999, depending on who you ask. During an outbreak amongst pig farmers in Malaysia, so it went from bats to pigs in Malaysia and Singapore. Again, trans-species jumping. Evidence that Nipah virus can infect dogs, yes. Cats, yes. Goats. Horses, there's certainly been cases of transmission from horses and probably sheep as well. So basically, this has the potential to affect higher vertebrates, such as ourselves and these more advanced animals. Natural host of the virus is the fruit bat, sometimes called the flying foxes, particularly those of the Petroporus genus. Sorry, it means nothing to me, but I put it in to look scientific. No, just put it in because I copied and pasted it actually, but that's the particular genus that transmits it. The fruit bats, or they are very big bats actually. They're called megabats, so they're huge things. Some of the biggest species of bats. Now, symptoms of the Nipah virus. Incubation period, typically 4 to 21 days, but it can be longer. Sudden onset of non-specific flu-like illness and fever, so you just start feeling really ill. Pneumonia and other respiratory problems can develop. Encephalitis, which is inflammation of the brain, or meningitis, typically develops 3 to 21 days after initial symptoms. Of course, this is a very dangerous condition. Severe headaches, horrible, must be completely horrible. Drowsiness, blurred vision, cough, abdominal pain, achy muscles. Case fatality rate, as we've said, is high, probably over 50% in most cases, even with young fit people. Some survivors may be left with lasting neurological deficits, persistent seizures and personality change. So not good. That can happen. In rare cases, the virus can reactivate months or even years after initial infection. Diagnosis, well, there is a PCR, real-time polymerase chain reaction, of respiratory samples, blood or cerebrospinal fluid if you took some from a spinal tap from a lumbar puncture. And antibodies can be detected in the blood. Where is the virus found? Human outbreaks only have been found in South and Southeast Asia, particularly in rural or semi-rural locations where there's fruit bats and fruit. And we'll just remind ourselves on the map of the locations where there's been confirmed cases. Thankfully, geographically fairly isolated at the moment. Although the distribution of the bats is much wider. In fact, the distribution of the bats, I'm pretty sure, goes down to Australia. So there is risk there. There is risk. And I believe that antibodies have been found in bats in a much wider distribution. So the infection is more widespread than the spillover events into other species, thankfully. Meaning that transmission from the bats to other species is hopefully fairly rare. Another reason for not getting overly worried about it, especially if you live in Western countries. Bangladesh has had pretty well annual cases since 2001. India outbreaks in Kerala since 2018. Current outbreak is mostly in West Bengal, but also in Malaysia, the Philippines, Singapore. Now, how is it transmitted? Well, direct contact with an infected animal or their secretions is possible. Consumption of fruit or fruit products if the bat has been nibbling it or another infected animal has been nibbling it. Raw or partly fermented date palm juice. I think this is what they make the sugary thing jaggery out of. You see these pits all over in northern India. So it's very sweet. So raw or partly fermented date palm juice, because if the bat had had a suck of some of it, it could all be mixed in, of course. Especially if it's contaminated with the fecal material, with the poo, urine, saliva of an infected fruit bat. That would be very bad. Person-to-person spread, this of course is the big one in terms of pandemic risk, is thankfully fairly low, unless they mess around with it with gain-of-function research in the lab, unless the virus mutates. But so far we have no evidence for either of those. It's possible through close contact with an infected person or their body fluids. So obviously in healthcare environments, full PPE would be used. This has been documented in Bangladesh, India, most common amongst family members and close contacts caring for the infected patients. Those with respiratory symptoms may pose an additional transmission risk. As we say, it's not an airborne, aerosolized infection like SARS coronavirus 2 or influenza, but there is the real potential, in fact likelihood of it being spread by close quarter droplet infections from infected secretions, particularly coughs and sneezes, but even from normal breathing. Treatment is supportive. No proven specific treatment for Nipah virus infections. We don't have any. No preventative vaccine is licensed for use. Having said that, in the healthcare environment, we can support these patients, but it is only supportive and the death rate can still be high. Prevention in endemic areas. So how do we avoid getting this? Avoid contact with bats or their environments, of course. Avoid contact with sick animals in case they've got it. Don't consume raw or partly fermented date palm. If consuming date palm juice, ensure it has been boiled first, and the same will go for other fruits as well. Wash your fruit thoroughly with clean water and peel before eating. Or soak in iodine. We used to soak our fruit in iodine in places like Nepal and in India. Iodine will kill. As far as I know, iodine kills all viruses, so I assume iodine kills Nipah virus at sufficient concentrations for sufficient contact time. Anyway, that's the advice: to peel. Avoid fruit lying on the ground or fruit that appears to have been partly eaten by animals. Do not eat. Good hand hygiene, particularly after caring or visiting sick people. So good hand hygiene is important. We don't want it going into our own mouths. Avoid close contact, unprotected contact with anyone infected with the Nipah virus, including contact with their blood and body fluids. So particularly for carers, need to be very cautious. In healthcare settings, strict infection prevention and control measures are essential, but we practice these routinely anyway. And apart from some poorer areas where the PPE might not be available, which is a potential problem, including contact, droplet and airborne precautions for both suspected and confirmed cases. So we would assume that there's droplet transmission. We would assume there's airborne transmission from aerosols, although the aerosolization transmission is less likely, according to the sources that I have been reading. So there we are. That's the Nipah virus. Potential for a pandemic if people mess around with it and increase its gain of function. Potential for wider local spread. Very important for good health education. But are we going to see it as a new pandemic invading our countries as things stand? No, I don't believe we are. But there is a real risk here. This just shows the risk of gain of function research. And it could well be being carried out. It probably is somewhere. There's no limit to the arrogance of human beings who think they contain it but then find it leaks. If they were to increase its transmissibility between humans and it were to be released from the laboratory, it's not melodrama to say this could kill 50% of human beings. But that applies to quite a few other viruses. But as it is, don't worry about it too much. It's limited to these countries, and it's mostly transmitted directly by these bats, although it can be transmitted to other animals, and of course some other animals like horses and pigs to humans. And there is the potential for some human-to-human transmission, although practically we've never seen it in Western countries. The cases have never been confirmed, which of course is very reassuring and intimates that it might not be that transmissible between humans. Because if someone had it on an aeroplane, you know what aeroplanes like, I always get bugs when I'm flying, it probably would have been transmitted, but it hasn't, which is encouraging. So plenty of things to worry about. This probably isn't one of them, but that's the investigation into that for now. So as always, thank you for watching.